We're here today to welcome Shelli Myles, who will be joining our treatment team here at the Institute in January. Shelli's a psychotherapist who specializes in neurofeedback. Although we've referred our clients for neurofeedback for years, we're thrilled to have Shelli join our team and work with all of our kiddos as a part of our treatment team. So welcome, Shelli. Why don't you start by telling us a little bit about yourself and how you became interested in neurofeedback?
Okay. I am a single mom of 7 children. I have 3 adopted girls from the Ukraine. And I did adoptions for Ukraine for about 8 years. And when I was in grad school for counseling, one of my professors did neurotherapy. And so I became interested, and we actually did treatment on 2 of my daughters. And just the results were so amazing that I decided to go down that road. And so my youngest daughter was actually highly ADHD, and so we did neuro on her. And she was on medication, and I honestly could not handle having her during my parenting time without her medication. She was so hyperactive. And so after neuro, she has been off medication for about 5 years now.
Wow.
So that in itself was a testimony. And then just seeing lives changed and watching people through neuro and doing it myself. After I had surgery, I had some depression issues. And so I did neuro with talk therapy and mindfulness, and just had great results. So again, that's really what got me started in neurotherapy.
Wow, 7 kids.
Yeah.
You have a personal connection, which is great, because here at the Institute, most of our employees, most of our staff their heart is in it. So we're so excited to have you with us.
Thank you.
Can you explain how neurofeedback works and why it's such a great tool for children with developmental trauma?
Neurofeedback is looking at the brain, the QEEG. We do a QEEG of the brain, and we look at the brain waves, and we can base that off of studies, the standard deviation of how the brain should work at its optimal. And so we train the brain according to where there's deficiencies or there's an excessive amount of brain activity, and change the neurological pathways of the brain for it to function properly. So it's very effective for PTSD, trauma, a lot of kids that are impulsive, again, academically, #1 treatment for ADHD according to the American Pediatrics Association. So again, I just think it's a great tool to help these kids further their development and to kind of retrain the brain to do what it should do after being traumatized.
And neurofeedback works kind of for everybody.
Correct.
Okay.
Yeah, I mean, we do. I've worked with athletes. I've worked with PTSD. I've worked with depression, OCD. Again, that impulsive, obsessive ruminations. It seems to really make a big difference with that as well. So.
Okay. Well, I wanted to talk to you more about how your work will tie in with our model and our treatment plan. So I wanted to introduce Forrest, who's our executive director, and you guys can talk about that together.
Okay.
So how will Shelli tie in with our model and our staff and treatment plan?
Well, that whole circle of security that's so important, where the therapist, psychiatrist, the treatment parents, the placing parents, all the clinicians are all on the same page. So the fact that Shelli's, adopted, she understands trauma, that her passion and commitment really fits in with that circle of security from our perspective. So it's just another piece of the puzzle for us as far as brain dysregulation, that kids all come in with their own trauma histories, but all of them share that common PTSD brain dysregulation. So adding neurofeedback just is another, I think, gift for our model.
Yeah, and that's great that you have that personal background.
Yeah, it's a passion of mine. For sure.
Well, and the other part is that she'll understand, our treatment parents and what they're doing and why they're doing it. So, whatever feedback they give her, will be helpful for what she's doing as well. That's why, whenever we're doing team meetings, everybody's on the same page. And it's so important for the kids to know that everybody's operating from that common space with them, that they understand the behaviors, they understand it from a neurological, emotional, psychological perspective. That's so valuable. that kids actually feel more secure and more connected when they know everybody is talking the same language.
And so you brought in a guest today,
I
your
did.
daughter, you can show us how neurofeedback works a little bit. Of course, it won't be the full spectrum, but just to show us what it looks like.
Okay. You ready? You want me to just hook her up while you're videoing?
Yep.
Okay. Do you want me to explain as we're going?
Yeah.
Okay. So we have this impedance meter which connects to a cap, a neurological cap. And we prep before we do that. Oops. And then the cap has little electrode spots that connect to all the areas of the brain. And so we're going to put that on her head in order to read her brain waves.
And some people ask, are you putting electricity in your brain? It's so important to know. It's no, you're reading brain waves.
Exactly. There's
Because
no
some kids
input.
will say, "What are you doing in my brain?"
Right. So these are just actually looking at the brain. So when the brain does what it's supposed to, the feedback is just positive reinforcement. We are not stimulating the brain whatsoever. This little strap goes around your waist to pull her cap tight. And really we do just the cap mostly for when we're collecting the data. And then when the kids do treatment, there's just electrodes that we stick on the brain head. So we're going to connect her here. And then we use the ears for grounding. So we're going to ground her ears with little clips.
Honestly, the equipment's changed since I went through my training, 7, 8 years ago.
Yeah.
It's really advanced.
Yeah, it's pretty amazing.
Yeah.
This impedance meter is just incredible. It's a European device. It's not the Brain Master. So we just get really good readings with it.
Mm-hmm.
So then we fill each of these holes with gel, and we're able to see the brain waves live, and we record them. And then we look at the brain and how it is functioning so that we can set a protocol in order to work specifically for her brain in areas where we see that there's problems. So during the session, she just watches a video game or a movie, and when the brain does what it's supposed to do, it gives her the feedback. It gives her a beeping sound, there's tactile, sound, or visual rewards. So the brain seeks those rewards, kind of like when you're riding a bicycle. Once the brain learns how to do it, it does it on its own. So what we do is it's operative training, is we do it over and over until the brain learns how to do it on its own. So really all they do is sit. There's nothing that they have to do except relax and watch the video or the game.
That's fascinating. You're a trooper.
We're the lovely. She's been in this cap a few times.
So a question that comes up a lot from parents and a lot of people interested in it. How long does this take? And, does it stick? Does it stay?
Right. So it takes I usually do 30-minute sessions. They can go up to 40 minutes for the whole time of training, depending on the severity of the child. And then really ultimately 30 to 40 sessions is recommended for the brain will learn that way because it memorizes it, and then it starts doing it on its own. And our goal, because it's operative training, the more you do it, the brain starts going, okay, this is what I'm supposed to do. And so then it does it, and it does stick. It's like riding a bike. You get back on a bike, your brain knows how to do it, how to balance it, which is something that your brain learned when you were younger. So unless there's some neurological issue like Alzheimer's, dementia, or something that happens, the brain will memorize what you've trained it to do.
So, Forrest, how will this tie in with the work that you do with Kathy Collins?
Well, that's a great question because I think, what Dr. Collins does is to regulate the brain through medicine. And so that will help the brain calm. What we hope neurofeedback does is actually train the brain to correct for whatever shortcomings it has as far as what it's learned as far as trauma. And so that we want neurofeedback to be more of a fix, whereas medication is more of a management of dysregulation to give us a chance to do parenting and therapy. So you put the two together, I'm really excited about that. So that eventually kids won't have to be on medicine or as much medicine to help their brains calm.
Mhm. So it's a real comprehensive package. So having Shelli on board is really exciting. Well, thank you so much for being here and thanks for volunteering.
You're welcome.